Welcome to Skyscape's orientation series. This is the student orientation, which will walk you through the benefits and use of Skyscape. Our presenters today are Dr. Tim Bristol and Karen Sherrill. I will now hand the floor over to Karen.
Thank you, Kristen. Today, Dr. Bristol and I are going to be talking about some ways in which to use the Skyscape product. We are quite experienced nurse educators, and we have been advocates for this product for many, many years. We see the value in having students have the ability to access their handheld, the ability to access their resources, whether that be in classroom or in clinical, in the lab settings. We find a lot of value in it, and we've each seen the progress that students can make with the use of this product in an effective way. So why is it that this works? Well, this type of a product is really helpful in that it's available, it's accessible. Students find it very convenient. It's so much easier to have your resources available on a device in your pocket rather than in a textbook, which may be in your backpack across the room. Things are very accessible. And in fact, these can be very cost-effective as well. The more you use these particular resources, the more cost-effective it's going to be for you. So where can you be utilizing the Skyscape resources? Well, consider ways you can use them in your classroom. Maybe your instructor has passed around a case study that you need to work on, and you're working in small groups with that. You could utilize your resources in order to access different items that you have, whether it be looking up labs or medications or disease processes that need clarification. You could use these products in lab and also in the simulation lab. There's oftentimes in the simulation lab where students are kind of stuck on, don't quite know what to do or how to administer them. So you can utilize your resources in those ways as well, which can be very effective. And of course, clinical, which is the most common place that we think to utilize our resources when you're stuck on a particular care plan of care or on a nursing concept map that you're doing for your clinical rotation. These are great ways in which to access these resources. They really are built upon the ways in which our students learn. The education process in nursing education has changed dramatically over the years, and these types of products are very similar to things that you're using in other platforms, whether it be through social media or other forms. You're used to having these resources and information available thanks to the reliability that they provide. The resources are quite up to date. They're frequently having updates provided that will allow you to have the most current evidence-based practice. It really allows you to know that what medication you're administering to your patient is in fact something that has the most current research. And whether it's a skill you're performing, you're going to have the most up-to-date information if there's been changes in the way in which we care for our patients. The mobility is so wonderful. The fact that you're not lugging around your heavy backpack and you don't have your 3,000-page textbook that you have to carry. In our program, we one time had a challenge between students, and we had students that had the handheld device and looked up things on that versus a student who was having to look in their textbook. And we were amazed at how much more quickly students could utilize the information they needed within this resource rather than trying to find in the appendix or in the reference page of their book and turn to the proper page and find the location they needed something. The access of these resources was much quicker for those students that were utilizing this form in which to receive those. Students are sometimes concerned about the cost. They're worried that they're putting this additional amount of money out there and it may be something they use or not use. Well, if you choose to use it, I would encourage you to commit to using it. And in fact, if you look at one of the most common packages, the Nursing Constellation Plus package, the cost of those on your Skyscape package is actually 30 to 35% less than the same textbooks would be if you bought those in person. So this is in fact money saving, and you can recognize that this is something you can have available to you not only while you're a student in the nursing program, but also after graduation when you're out in practice. It'll provide those same resources to you so that you can be a safe and competent nurse. I'm going to now turn the presentation over to Dr. Bristol, who is going to demonstrate some of the components that it has.
Thanks much, Karen. So for students, when you're looking at Skyscape, keep in mind that there's a lot of opportunities here to help you save time while you're studying to help you make what you're studying more real, more permanent, if you will. We know that when you're trying to learn a new concept, it really does help if you can look at the concept not only from different angles, which as you can see here in my Skyscape, I have the nursing constellation plus a few other books that I need as well. You can look at it from a number of different angles, but you can also quickly access updated information, which a lot of times if you're looking through a number of paper-based books, your information might be a bit dated. So this is really going to help you learn better when you're using this tool. So there's a few things that I want to show you in the Skyscape app that are going to help you save time. For instance, right there at the top center of the page is the Smart Search bar. And this is the same on your iPhone, your iPad, your Android, whatever. Maybe you heard the instructor say a word in class that you didn't quite understand. Maybe you're studying your textbook and you find a word that you don't understand. Maybe you're in clinical and you heard the physician, she said a particular word. Well, you can do a quick smart search to find that word. What were they talking about? So one might be rheumatoid. Let's see if I spell it right there. And it looks for this word through every single book on my device here. And so, for instance, I purchased the clinical companion for my med surg book. I wanted something on here that I could quickly reference. Another way to search would be using SmartLink. So I'm going to open up my clinical companion, and I'm in class. Let's pretend like I'm in class, and I hear about rheumatoid arthritis, or the instructor's talking about rheumatoid arthritis. I know an update just came through on my clinical companion, so I want to open that up. And I go to, there it is down here at the bottom, arthritis, rheumatoid. Now I have this monograph, this quick, very up-to-date information, very concise and to the point, because I'm going to use this also in clinical. So I've got this good information here now on rheumatoid arthritis. Now we looked at Smart Search on the main screen. When you're inside one of your tools here in Skyscape, there's another way to search that's based on clinical, importance. And so this tool is called Smart Link. All right, if you look in the bottom left-hand corner there, there's a little carrot, a little red-blue carrot. You tap that. The very first tool there is the Smart Link tool. And I tap that. Essentially what it does is it looks through all the other books and it says, where does rheumatoid arthritis show up clinically related to me providing care for a patient with rheumatoid arthritis? Well, there's my drug guide right there in the middle, my Mosby's Nursing Drug Reference. I can open that up. It says, what medications are being used by patients with rheumatoid arthritis? And I go in and there's my methotrexate, and I can look through that monograph and just kind of better understand. So there's Smart Search that does a quick search of all the books for a particular word. There's Smart Link that looks for clinical concepts, clinically relevant material. And so it's very nice to use when you're wanting to think clinically about a concept. So that's Smart Link. The calculators, there's a number of calculators available to you throughout Skyscape that really help you better understand what you're learning. So let's say that you're in a lecture on neurology, and the instructor mentions the Glasgow Coma Scale. Well, you can, write down whatever's on the instructor's PowerPoint for the Glasgow Coma Scale, but you could actually do it and practice it during lecture. Open up your phone, if you will, and type in Glasgow in this clinical calculator, and you can practice actually using it the way you're going to use it when you're in clinical. And so, I just list what I see in the patient, my assessment data, and if I have a question, the nice thing here, because this is a clinically relevant tool, I can go down here and get more information on what each of these areas actually means. The nice thing here is, if I'm truly going to learn the Glasgow Coma Scale, using it the same way while the instructor's lecturing, if you will, then what will happen when I'm in clinical? So this is going to make you learn, you're learning just, you're going to save so much time. It's not just writing down a bunch of words on a piece of paper and going back later and trying to decipher your notes. Here you're actually using the tool. Another clinical calculator. Everybody loves IB calculations, right? I hear you groaning. Here's where we can go in and actually make sure that our calculations are correct. Make sure that we understand how the calculations are made. So this is, for instance, an infusion rate. So let's say that our patient weighs 66 kilograms. In the bag, we have 250 milligrams of dopamine in a 400 cc bag, and maybe the order is for 3 micrograms per kilogram per minute, okay? So what do I set the pump at? I set the pump at 19 mils. So what this does is this really helps me better understand. It helps me do a double check of that calculation. I'm just going to learn better, if you will. I'm going to save time while I'm learning that. Now, another thing that's important is we have to understand how we learn, and this is where a lot of the media that is built into this that you're not going to have in a paper book. So one of my favorite dictionaries, the Taber's Dictionary, you'll notice that here in the lower left-hand corner. If you have this in paper, great dictionary, as long as it's updated. It's the most recent one you can get. When it's on your Skyscape app, it can be updated even more. But the other part of this is the media that's built into it. All of us have had trouble saying words before, said a word incorrectly. So I'm going to pick an easy word, gate. You'll notice the first thing that happens when you look up this word, there's a little speaker there next to the pronunciation, and you can actually hear how is the word said. What does the word sound like, okay? And that helps me out tremendously, because sometimes, you know, I look at a word and I try to pronounce it phonetically. It doesn't quite work out. Another thing that's really important, you're going to find a number of videos throughout the Skyscape app that are not going to be in the paper book. And so, for instance, if you're thinking about the concept gate or the word gate, you can actually come here, and there's a video that gives you examples that helps you better understand this word. Again, in the good old days, we would just memorize the word gate means X, Y, Z. Now we can actually see gate, we can hear about gate, we can look more intensely what gate actually is. So you're going way beyond just memorizing a term or looking up a word in a dictionary. You actually have these videos, these pronunciations that can help you as you're trying to understand this information. And keep in mind, because this is on your phone, this is on your iPad, you can get it anywhere. You can get access to this anywhere. The other area that's important to me is history and bookmarking. So a lot of different things are happening throughout the clinical day, and I can try to go back and figure out where have I been. Okay, so for instance, we looked at arthritis, rheumatoid, or maybe we looked up appendicitis. I'll just take that as an example. And I'm like, you know what, I think I might need this later today during clinical or during my simulation when I'm in lab, or if I know that the instructor is going to bring this up in lecture today, I can bookmark it. You'll see the little green book right in the middle there. Okay, there's the little green book. Or if something more recently has happened, I'm just going to add my appendicitis bookmark here. Or if something more recently has happened, I can actually go into my history and go, now where was that Glasgow Coma scale? Let's see, there it is, and I can open right back up to that Glasgow Coma scale. And again, the history and the bookmark works across all of my books. It's not just like I'm looking in the index or the table of contents in one book trying to find out where did I see that. Well, I don't have to ask that question because the bookmark feature, the history feature, covers that for all of my books in my Skyscape app. So just some ideas there for you to help you save time when you're studying, help you do a better job when you're in lab, when you're in clinical, and way more interaction there. So I'm going to turn it back over to Karen now.
Thanks, Tim. I just wanted to, as we wrap things up for this, I wanted to share with you a couple of exciting upcoming ideas that are going on. Some are currently ready to use by Skyscape, and some are in production. But what you see on the screen right now is the portal page, and there's a variety of different opportunities within this. Some of the components here that are available to you, one of them is a word game, which is called SnapWord, and you can find it under the play button on your portal right here. And it's actually available to you now on iTunes within the App Store, and it will just help you to build a better vocabulary of medical terminology using that word game. There is also a NCLEX question of the week that Skyscape offers, and this is fairly new. It is available through their Facebook page, or you can obtain the question of the week by going to skyscape.com/NCLEX QOW for question of the week. And this will provide to you an NCLEX style question you can utilize for your study. An additional product which is going to be coming out soon is the Nursing Skills Hub app. And what this is it's a base of 100 different skill checklists. Students are utilizing this within the clinical portion. They're using it within the lab portion. So you can use these checklists and walk through the steps of how to perform a particular skill. It will also have testing capabilities, so your instructors will be able to use this during a practicum or a skills checkoff. There will be videos included with this, as well as some additional NCLEX questions based upon that skill performance. We thank you for joining us. We hope that you found this helpful, and good luck to all of you. Goodbye.